Jordan in Frankfort, Kentucky. Hey, Jordan, what's on your mind?
Yes, Al, how you doing today?
Good. What's up?
Doing well. I would love if you could defend for me this notion of healthcare being a right, because it seems to me that that is the premise that Obamacare and even the idea of many parts of Obamacare and even the idea of single payer is built upon, this premise that healthcare is a human right. And I would love to hear you break that down for me because I have a hard time buying that philosophy.
Well, there's a number of things in this country that we have defined as rights. One of them is the right to an education. It's not in the Constitution, but arguably in the Constitution, where it says that the whole point of the Constitution is to provide for the general welfare. Actually, the preamble says it very elegantly. It says, in order to form a more perfect union, in other words, to keep the country together, to establish justice, it's obvious, that's self-evident, to ensure domestic tranquility, to keep people from being too, whatever, provide for the common defense, promote the general welfare, and secure the blessings of liberty to ourselves and our posterity, we do ordain and establish this Constitution. And then in Article 1, Section 8, where it defines the ability of Congress to collect taxes and spend money, it says that there's a very specific reason for that. This is Article 1, Section 8. The Congress shall have power to lay and collect taxes, duties, imposts, and excises to pay the debts and provide for the common defense and general welfare of the United States. And then it goes through and, to borrow money in the credit of the United States, to regulate commerce with foreign nations, to establish naturalization, to coin money, et cetera. So, the idea that everybody should have a free education, or at least up to the 12th grade, and it used to be up to the 8th grade until the 1930s, was an idea that came about in the 1880s in the United States, and it's passed constitutional muster a number of times because Congress decided that that was part of the general welfare of the United States. So if you take Franklin Roosevelt's words on their face, Jordan, and where he said, a necessitous man is not a free man. You're not free if you are sick and you cannot afford to pay for the treatment. Then I would suggest to you that, if another thing that we decided is a right, is to have a fire department protect your home. And so we all pay taxes to have fire departments protect our homes. It's part of the commons. We've agreed it's all part of the commons. So if we're going to agree that having your home protected from fire is a right, aren't our bodies more important than our homes, Jordan?
Well, of course, our bodies are more important than our homes, and I appreciate the constitutional basis for those things, but I'm more looking for a philosophical basis, because it seems to me that if I make the statement that my health care is a right to me, what I'm really saying is that I have a right to your resources, or whoever's resources I need to get my health care in order to maintain my health care. I mean, wouldn't you agree that really by saying that's a right for me, it means I have the right to take from you?
Yes, absolutely, Jordan. This is how society works. We all get together and we say, we really all want to have an interstate highway system. It would be a really good thing. And it's going to benefit all of us. It's going to benefit business. It's going to benefit individuals. And so we're going to pay for it. And somebody who doesn't have a car says, hey, I don't even have a car. Why should I be paying for an interstate highway system? Because ultimately you will benefit from that. People who don't have kids, they say, why am I paying property taxes to support education? Because the quality of life of the entire country is improved by it. If we don't have people carrying communicable diseases and walking around coughing with active tuberculosis in this country, and by the way, that's actually happening right now. 2 of the world hotspots for TB are New York and Los Angeles. If we don't have that, instead, if everybody in the country is covered with health insurance, you've got a national public health policy satisfied. It's the main reason why most countries want to make sure that everybody in their country has health insurance, or has health coverage, rather. We're actually the only country that does it with insurance. Well, we do, and Switzerland does, but Switzerland requires it be not-for-profit. It's the law. And so I would say that the interest of the general welfare of the United States, to make sure that we don't have rapidly moving, transmittable, communicable diseases, that people are going to stay sick and be coughing all over people because they can't afford the health insurance, to keep America safe and to keep America well, is, in my opinion, part of the commons. And when you define something as a right rather than a privilege, all you're saying is that government then has to figure out a way to deliver it. And so at that point, I'm just like with public education. Government says, okay, we've established that everybody has a right to an education. And all the rest of us have the obligation to pay into that because we are members of this society. And then government says, okay, we have to deliver a good public education, so how do we most efficiently do that? And we've got this debate right now about, is it public schools, is it charter schools, is it public schools with magnet schools, is it choice? There's a bunch of different options, and we're working through that process, but nobody is disputing the idea that everybody should have an education. We simply, in my opinion, Jordan, we need to go to that same place with regard to health care. And if we did, if we decided that health care was a right and therefore government had an obligation to make sure it was delivered to us, whether it's via, we can do it via Obamacare and continue to spiff the health insurance industry to the tune of $500 billion a year, or we could do it through single payer. And we can take that $500 billion a year and, cut your taxes, Jordan. I mean, it's just enormous things that we can do.